and my name's Pam Ferrer. I'm the Macmillan Prostate Cancer Clinical Nurse Specialist at Northampton General, and I'm part of a project alongside the colleagues from Kettering General Hospital who've been setting up clinics county-wide for patients with stable prostate cancer. We have made these videos for you so that you can look into some of the side effects and symptoms that you may find that you get as a result of your treatment. This one is about managing hot flushes. Hot flushes affect about 75% of gentlemen who have hormonal treatment for their prostate cancer. They can affect gentlemen at any age, whether they are on the LH-RH injections such as Decapeptyl, Prostate or Zoladex, and also on anti-androgens such as bicalutamide. The hot flushes vary in their intensity, and for some patients they will only last for a few minutes or seconds, and for other people they will go on for up to an hour. Sometimes they will become milder, and sometimes people find that they really happen very, very frequently and cause them quite a lot of distress. There are various treatments that we can consider to help you with your hot flushes. NICE recommend certain tablets for you to take. The first one that they would suggest that you would use is a tablet called medroxyprogesterone. This is a tablet that you can trial for up to 10 weeks, one tablet a day, and again, it may help you to a certain extent with your hot flushes. If medroxyprogesterone isn't successful, we would change you onto another tablet called cyproterone acetate. This is a tablet that is an anti-androgen. We would normally start you on a 50 milligram tablet once a day, but the dose would be increased depending on how effective it is for you. In using either of these medications, we need to keep a close eye also on your liver function. The other tablets that we may use are drugs like antidepressants. Drugs such as venlafaxine and sertraline may help to control some of your hot flushes for you. The way that they work is by suppressing the hot flush urge, and so hopefully this will improve things. We can also sometimes use other medications such as gabapentin, which is a form of pain relief which you may have had. But we need to make sure that any of these drugs that we try do not affect any of the other medications that you're already on. In terms of practically managing your hot flushes, sometimes it is easier for patients who don't want to have additional medication just to go down the simple route. So using natural fabrics such as cotton and wearing layers that you can take off as you get very hot. Carrying a little portable fan around with you in your pocket with a battery operation that you can get out and use as you need can also be useful. During the night when you're in bed, a silk pillowcase can be quite useful. Also, cotton sheets and layers of bedding which you can throw off are beneficial. You can also buy a special cooling pillow or chillo which may be effective. You can buy cheaper versions of this or cooling sheets, and having spoken to patients, they sometimes feel that the chillo is a little bit difficult due to filling it up. It seems that it absorbs the heat in and then doesn't release it again, where the cooling sheets seem to work better. When you're having a drink, try having cool drinks rather than hot ones, as having a hot cup of tea is likely to exacerbate your hot flush. The other thing that can be very effective if we've tried some of these simple treatments is considering something like acupuncture. Acupuncture is generally done as a treatment for you at one of the specialist centres. So the physiotherapists who are based at Cransley Hospice and Cynthia Spencer Hospice will arrange to do acupuncture for patients as a course. This has to be arranged, and obviously there would be a waiting list to have this done, and normally this will be over a period of at least 6 weeks to see how effective it can be. Patients that have had this during our wellbeing sessions have actually found some effect almost immediately and have been very pleased with the effect that they've had. The needles that are inserted are very fine and just below the skin and encourage the nerves to release natural chemicals into the body, such as endorphins. These are substances that give off a feeling of well-being and therefore help to relieve the hot flush for you. There isn't a good amount of evidence at the moment, but there seems to be a lot of anecdotal evidence from patients about the effectiveness of this. Consider lifestyle changes. A reduction in your alcohol intake and a reduction in the amount that you smoke may be beneficial. Look at the NHS website or NHS Choices to find information about this. If you are slightly overweight, then losing some weight may also be beneficial in order to maintain your health and allowing the hot flushes to subside a little bit. Your energy levels will therefore improve, and so will your sense of well-being. Psychological treatments, such as cognitive behavioural therapy, can also help in the management of your hot flushes. This is a way of thinking positively about yourself, and there are simple things like using an elastic band on your wrist that can help with things like this. Guided self-help cognitive behavioural therapy seems to be quite a safe way, and also is quite a brief treatment for gentlemen who have problematic hot flushes following your prostate cancer treatment. A hot flush diary is also something that is quite useful to keep. This is when you write down the amount of hot flushes that you're getting during the day and the number of hot flushes that you get overnight. The severity of your hot flushes you need to document. Some people feel that they get the heat swelling up from their feet, and some people will literally sit and drip with beads of perspiration. So consider jotting down how often they happen so that when you are seen or speak to a nurse specialist, you can discuss this with them, and then we can consider what is the best form of treatment. Other simple things that were not mentioned earlier are things like evening primrose oil capsules and sage. Any of the medications that you try, you obviously need to discuss with your pharmacist as to whether you could try these, but some patients prefer to go for a more of a herbal option rather than medication. Any of the details about hot flushes can be found using the Prostate Cancer Charity website, where the leaflet is there available for you on hot flushes, or contact your clinical nurse specialists on the telephone numbers on this slide. Thank you for watching, and if you have any further questions, please do not hesitate to ring one or other of us.